The bill before us is the culmination of 5 years of work. 5 years ago, the legislature created the Iowa Direct Care Worker Task Force, and they were charged with trying to come up with a means to ensure quality of services and health care for the most vulnerable of Iowans. And I'm talking about people who are living in nursing homes, assisted living, residential care facilities, group homes that care for those among us who have a disability. In addition, the state was one of only 6 that got a federal grant to create a national model and curriculum that other states can eventually adopt to ensure that direct care workers across our country are properly trained and educated to care for these folks. The bill before us is pretty simple. We are creating a board that will oversee the curriculum, will take complaints, etc., from workers as well as customers, and it will begin to address the quite frankly radical turnover rate we're currently having in our state. We have anywhere from 60 to 67% turnover annually. It's costing our taxpayers and employers about $189 million each year from the turnover itself, as we have to retrain and get everybody back up to speed. The bill creates a pathway and professionalizes this occupation that is the largest occupation in our state. With 73,000 workers right now in our state that are employed in this field. And as I say that, we also know that we have a 12,000 shortage coming up in the next 6 years for the number of direct care workers our state will need as our population continues to age. The career pathways starts with a core, and then advanced, and then specialty certificates. So if someone wanted to get into specializing in autism or Alzheimer's or whatever it might be, they can also do that.
Return to the senator from Dubuque for final remarks.
Thank you, Mr. President. The bill really is in the best interest of the most vulnerable people of our state. If we would choose to do nothing, what we are basically saying is the ultimate losers are the Iowans that receive care and support. By doing nothing, we would be saying that no training standards for all workers is just fine. We should continue the way we're doing it. That the public doesn't need to know who's providing the service to them and what their qualifications are. If for some reason we would continue to reject this bill, we are saying that a 60% annual turnover is just fine. And that the quality of care and services for Iowans doesn't need to be improved. Members, this bill is truly a step in the right direction to ensure that those who take care of the most vulnerable of Iowans have the training and the qualifications to do so. With that, Mr. President, I move its adoption.